Today we're going to do a head-to-toe assessment, and we're starting with the equipment, which is a pen light, a toothpick, tongue blade, and a cotton ball, and stethoscope, hand sanitizer, and gloves.
Come in.
Hi, my name is Erika Trujillo, and I am a nurse student. I'll be helping your nurse today. Is it okay if I touch your body for a head-to-toe assessment? Do I have your permission?
Yes.
Okay, thank you. Please have a seat for me. I'll wash my hands. While I'm washing my hands, do you know what day of the week it is? ¿Qué día de la semana? ¿Qué día de la semana?
Viernes.
Okay. And where are you at right now? ¿En dónde está?
En la clínica.
Okay, perfect. And what do you come for? ¿A qué vino?
Chequeo físico.
Putting on my gloves. Okay, for physical. Thank you. Let me see your name and date of birth. Su nombre y su fecha de nacimiento.
Elsa Romero, enero 23 del 66.
Okay, thank you. Okay, can you lay down for me? So the patient seems alert and oriented ×4. And before we start the head-to-toe assessment, have you felt like hurting yourself lately? ¿Tenido
No.
infecciones? Okay, and do you have any pain?
No.
Okay, perfect. Okay, we're gonna start, and as you can see, she had full range of motion and walking towards the bed. There seems to be no signs of needed assistance, and her appearance is the fat is well distributed, and she's dressed appropriately for the weather, and she appears to stated age, and the skin tone matches her ethnicity. So we're gonna start with the head first, and we're gonna start with the hair. And the hair seems to be no signs of infestations or alopecia. Does this hurt?
No.
No masses, no lesions, no bruises on the head. And now we're gonna continue with the temporal pulse, and it's a 2+ bilaterally. Can you open and close your mouth? Okay, full range of motion on the temporal mandibular joint, and no crepitus or tenderness. We're gonna change my gloves. And we're gonna continue with the eyes. There is no drooping or ptosis on the eyes, and they're very symmetrical. There's no infestations on the eyelashes or the eyebrows, and there's hair well distributed. The eyes are round, and the eyeballs appear to be in their sockets. No protrusion or sinking. The sclera is white, and the iris are color hazel, flat and round. And we're gonna check for the conjunctiva. Can you look up for me? So it's nice and pink in color and shiny and moist. There seems to be no discharge. We're gonna dim the lights to do perla. So can you please look up to the distance? Look at me, to the distance. So twice on each side. 1, 2. And now we're gonna turn the lights back on, and if you can please follow my pen. So pupils are equal in size, round, and reactive to light and accommodation. So now we're gonna continue with the ears. So I'm gonna change my gloves. Okay, hand sanitizer, and put my gloves back on. And we're gonna continue with the ears. So the ears appear to be equally bilaterally. And does this hurt?
No.
No tenderness, no lesions, masses. The tympanic membrane seems to be nice and moist with a little bit of cerumen. No tenderness, no redness, and the tympanic membrane seems to be pearly gray and translucent. Now we're gonna continue with the nose. So the nose appears to be appropriate for the face, and the color matches the rest of the skin tone. Does this hurt?
No.
Okay, perfect. Can you tilt your head back? I'm gonna check inside. The nasal mucosa seems like a light pink, and there's no exudate. The turbinates are like a dark pink color, and there's no deviated septum or protrusion on the septum. We're gonna continue down to the mouth. Let me change my gloves again. And now we're gonna continue with the mouth. And can you please open your mouth wide for me? So the lips are nice and in shape and light pink, and there's no cracks. The inside of the mucosa is nice and moist and color pink. Can you stick out your tongue for me? Thank you. The tongue seems to be full, covered in papillae, a nice size appropriate for the mouth, and the tonsils appear to be grade 2, and no exudate present on the tonsils with light pink color. So we're gonna change my gloves again. we're gonna go down to the neck, and we're gonna can you please look up for me, stick out your neck. There seems to be no lesions, masses present on the neck, and we're gonna go check on the lymph nodes. We're gonna start with the preauricular nodes, postauricular nodes, superficial cervical, down the deep cervical chain of nodes, and the posterior cervical nodes. And there seems to be no inflammation or swelling, no big lumps or masses on the lymph nodes. You can lower your neck now. We're gonna check for bruit. So we're gonna check with the bell or the stethoscope, and there's no signs of bruit. Now we check for the pulse and carotid. Pulse is 2 plus bilaterally, and now we're gonna continue down the thorax. Can you please stand up? We're gonna stand up for the purpose of this video so you can see my locations. ¿Se puede parar, por favor? Voltearse. Okay, so we're gonna continue with the auscultation and the inspection first. There seems to be no lumps, no masses, and no kyphosis, lordosis, or scoliosis present. It seems temperature is equally distributed, and we're gonna start with the auscultation. We're gonna go with the left apex of the left lobe above the scapula, the left scapula. Deep breath in, respira profundo. And the other side on the above the right scapula for the right apex of the right lobe. Awesome. We're gonna go on the T3 in between the scapula. That's the right upper lobe, left upper lobe on the T3 left side. Then it's going T6 left side for the breath. Thank you. Is the left upper lobe, lower lobe, and the right lower lobe, T6 on the right side. And then can you please lift your shirt up a little? On T10, we're gonna have on T10 deep breath in, respira profundo. It's gonna be the lower lobe, the right lower lobe, and then the left lower lobe on T10 on the left side. Can you please turn around for me? The AP diameter to transverse is 1:2 ratio. And now we're gonna continue with the front thorax, and it's gonna be the interior thorax. So it seems to be the skin well distributed, and there seems to be no signs of lumps or lesions or masses. And we're gonna palpate for pain. Do you have any pain?
No.
Okay, thank you. We're gonna continue to auscultate. So we have the right above the right clavicle, the right apex of the right lung. Deep breath in. Awesome. The left apex above the left clavicle of the left lung. Awesome. Then it's gonna be the second intercostal space for the left upper lobe, right upper lobe, second intercostal space, and then fourth intercostal space for the right middle lobe, the fourth intercostal space on the left side for the left lower lobe, upper lobe. Then we're gonna lift your shirt up. We're gonna go in the mid-axillary line for the intercostal space 6. Deep breath in for the left lower lobe, and then we're going to the other side to the mid-axillary lines, intercostal space 6. Deep breath in for the right lower lobe, and there seems to be no signs of any extra sounds. And now we're gonna continue down to the extremities. Please straighten your arms. So it seems to be the skin is evenly distributed, warm to touch, and it seems to be the radial pulse is a 2+ bilaterally. The capillary return is within less than 2 seconds. And now can you squeeze my hands, please? Okay, full strength, 5 out of 5 on muscle strength. And now if we can have bend your arms. Awesome. So it's full range of motion on the upper extremities. Can you please lay down here to check on the heart and the neck vessels? And we're gonna change my gloves. And now we're coming back for the heart. We have the patient now on the to check on her right side. So can you please look to your left? And we're gonna check with the pen light for jugular vein pulse, and it seems to be present. Can you lift the shirt up and your breast? And there is no apical pulse present down. And then we're gonna start with auscultating the valves, the heart valves, and we're gonna start with the right aortic, the right side, on the second intercostal space next to the sternum. For the aortic, we're gonna start with the diaphragm first, aortic valve, then across on the second intercostal space on the left side of the sternum for the pulmonic valve. Then it's gonna be the fourth intercostal space for the tricuspid valve, on the left hand side of the sternum. And then can you please lift your shirt up? And then it's gonna be on the fifth intercostal space, mid clavicular line for the mitral valve. And there seems to be no high or low signs of sounds. Now we're gonna continue with the bell for murmurs, and it's the same location, second intercostal space on the right side for the aortic valve, and then be on the left side for the pulmonic valve on the second intercostal space. And then it's fourth intercostal space for tricuspid on the left side. Please lift your breast up. And the fifth intercostal space, mid clavicular line for the mitral valve. No signs of murmurs present. And now we're gonna continue down to the stomach. Can you please lift your shirt up and bring this down? Thank you. ¿Cuándo fue la última vez que hizo del baño? When was the last time you had a bowel movement? So today in the morning. And what was the consistency, color, shape? What was?
Café normal.
Normal? What kind of normal? Like soft?
Brown, soft.
Okay, thank you. So this morning she had that. And we're gonna check for symmetry and the tone is his skin color. It matches the rest of the body. There seems to be no bruises or masses. Now we're gonna auscultate first, and we're gonna start at the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. There seems to be no extra sounds, and the sounds is pretty normal, active. And we're gonna go with light palpation. I'm gonna start at the right lower quadrant. Let me know if you have any pain.
No me duele.
Right upper quadrant, left upper quadrant, and left lower quadrant. And it seems to be no pain, no masses detected. We're gonna go down to the legs, and we're gonna check for edema. There seems to be no signs of edema present, and the hair is evenly distributed around the legs. And if you can please, if you can push, bend your knees, awesome. So full range of motion. Can you press against my hands and pull? Awesome. So there seems to be full strength, 5 out of 5 for muscle strength on the lower extremities. The dorsus pedis pulse is a 2+ bilaterally. Great. And now can please stand up for the Romberg test, and we're gonna check first. We're gonna check for sensory, for light touch, and we're gonna have a cotton ball. When you feel it, you're gonna say now. Close your eyes for me. Now. No, 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 no. Awesome. And now you can open your eyes and keep your hands to your side, your feet out to the side. We're gonna have you close your eyes, and we're gonna touch. We're gonna have you there for 20 seconds, okay, for the Romberg test. And we're counting. And do you feel that? No, 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 no. Awesome. 20 seconds passed by. Can you please open your eyes? So the patient had minimal swaying. That means it's a negative test for Romberg, and she had a full sensory for soft and light and dual and touch. So thank you so much. I'll change my gloves, and the doctor will be with you in a second. Thank you so much. And we're done.